Hi, my name is Marvin. I'm a neurosurgeon at Virginia Tech Carilion Clinic who specializes in skull-based tumors and cerebrovascular neurosurgery. Today I'd like to talk a little bit about skull-based neurosurgery, including the types of disease processes that we often see and some of the different types of surgical approaches that we have to offer. To begin with, skull-based neurosurgery tends to be one of the more complicated fields that we deal with on a routine basis. Skull-based neurosurgery involves dealing with tumors and vascular disorders that are located near the base of the brain or at the base of the skull. These are very complicated and complex pathologies for a number of different reasons. One is that they're very hard to get to from a physical standpoint, from a surgical standpoint. And two, they're often involved in and surrounding very important and critical structures of the brain, including the blood vessels, the cranial nerves, as well as the brainstem itself. Specialized training in advanced surgical techniques and complex skull-based surgery is a very important concept in treating these complex disease processes. For each patient that comes in to Virginia Tech Carilion Clinic, we deal with them individually. These individual treatment options may include surgery, it might involve radiation, and sometimes it might involve following them serial with repeat MRIs to ensure that there isn't any growth. When a neurosurgeon does recommend a treatment strategy, we implement those in a collaborative and team approach type of a setting. With respect to surgery, we have the technology and the skill set to be able to offer the most advanced techniques as well as the most minimally invasive options to treat these tumors. Some of this involves dealing with intraoperative microscopes as well as endoscopes. One of the tenets of skull-based neurosurgery is to avoid retraction on critical structures such as the brain itself, and specifically avoiding any injury to the cranial nerves or the vasculature that surrounds these tumors. These tumors are often very benign but can behave fairly aggressively and even malignantly if our treatment options don't address their slow and deliberate growth. Patients can often present with neurological deficits. They can also present with paralysis of one side of the body or the other, or even speech problems. Developing an optimal treatment strategy involves dealing with the risks and benefits of the natural history of the disease itself versus the risks and the benefits of the surgical approaches. The types of skull-based approaches often involve surgery through the nose to allow for minimally invasive approaches to the sella, specifically in tumors that are at or around the nerves of the eyes. We also do surgeries behind the ears, which will sometimes involve disarticulating the spine to get better access. All of these approaches are designed to minimize the trauma that we cause to the neurological structure and allow better access to gain maximal advantage to the tumor for a maximal resection and a minimal post-operative complication course. So each patient that comes into Virginia Tech Carilion Clinic gets a specialized, individualized, and focused treatment plan to allow for the best outcomes with the least risks. Thank you for your time.